Hello, my name is Frank Ategeka, and I'm the Executive Director and a co-president, Rural Aid Foundation in Uganda. I'm also a co-president, Global Health Corps chapter in Uganda. And we have around 1.4 million refugees. And when you look at the World Health Organization recommendation of the human resource personnel, health workers to the population, Uganda has actually 0.4 compared to 2.5 recommendation by the World Health Organization. And this has increased out-of-pocket expenditure for healthcare services for the refugees and the host communities in the country. Now, as Rural Aid Foundation, of course, we needed to look further than this and find a solution to this. And our solution is what we call the Send a Health Fellow to a rural health facility. And this is how the model works. What we do identify gaps and partner. So we look out to rural communities or refugee settlements which have the highest number of refugees and health care gaps in terms of human resource. Then we recruit health workers, and when we recruit these health workers, we train them on issues of universal health coverage, sexual reproductive health, LGBTI rights, and then after that, we deploy them to these health facilities. And after we've deployed them, we do, each of the fellows is meant to treat or reach out to refugees at a health facility where they are actually placed. And after this, each of the fellows is also meant to keep track of the number of refugees they have treated or provided healthcare services per month. And then after this, we do a transition. After someone has been on the fellowship for 1 year, they transit into an alumni community, which is an arm to keep advocacy for refugee health rights. And finally, we do, the alumni community keeps advocating for the rights of refugees, and one of the examples is just down right here in the picture. Then what is the impact of our work? You see that when we get one health fellow and we post them to a refugee community, each of the fellows can reach out to 83 patients per month. And in 1 year, you can have 1,000 patients or refugees treated annually by one health fellow. And when you get into 1 year, and for example, if you have 20 fellows posted for 1 year, 20 fellows would be able to reach out to 20,000 refugees with health care at no cost. Then during the fellowship year, each of the fellows is also meant to do a community outreach activity on a key health gap or identified challenge at the health facility where they are placed. And for each of the fellows, it has a target of reaching out to 100 people. For example, if you are placed at a health facility where there is a high prevalence of HIV, then you have to organize a community event and sensitize the community on HIV prevention. So each of the fellows can reach out to 100 people for a year, and during this one event. And when you have 20 fellows, then this means you have 2,000 extra people reached on top of the 20,000. Then in terms of the cost, we are speaking about universal health coverage. How do we aggregate this to in terms of money or expenditure for health? Each of the fellows, the cost of recruitment for each of the fellows is $270 for each of the fellows per month. And when we have 20 fellows per year, this comes to $64,800 for a year. And this means that the health cost per patient for the health care cost per patient per year is only $3.24. So you see, you have a small amount of money, but reaching out to a very bigger community. Thank you so much. And as I complete, I just call up everyone to unite our hands. Let's prioritize universal health coverage for the most vulnerable rural communities and refugees.